very excited to be here at the Health Experience Design Conference, and I am very pleased to be talking to Todd Park, who is the CTO of America. He advises our president on initiatives that would improve our efficiency as a country. So you gave a very inspiring talk about healthcare and how we can reform healthcare using data. Can you tell us more about your initiatives?
Sure. So this is an initiative that we got started at HHS, where I was before I joined the White House about a week ago. And the initiative specifically is called the Health Data Initiative, which Secretary Sebelius launched about 2 years ago. And the whole idea is to turn HHS into what we're calling the NOAA, N-O-A-A,
right,
of health data. So just like NOAA, the National Oceanic and Atmospheric Administration, has for decades now collected tons of weather data and published it in electronic machine-readable form for anybody to pick up for free without intellectual property constraint. HHS is now actually doing the same thing with just vast amounts of health-related data sitting in the vaults of NIH, FDA, CDC, Medicare, Medicaid, so on and so forth, with the idea being that just like weather data made available in machine-readable form seeded the development of, empowers the ongoing operation of so many powerful innovations, weather newscasts, weather websites, weather mobile apps, weather insurance, et cetera. The idea is that the liberation of health data, making it also machine readable, and publicizing its existence to American innovators will cause entrepreneurs and innovators to take up that data and turn into all kinds of useful products and services that can help consumers, patients, doctors, nurses, hospitals, employers, communities improve health in all kinds of ways that we can only even begin to imagine. And what's happened over the last 2 years is that entrepreneurs and innovators have done exactly that. They have taken our data and turned it into an incredible array of innovative products, services, features, capabilities that help consumers take control of their own health and healthcare by having the right information at their fingertips, helping doctors and nurses deliver better care, helping journalists write better healthcare stories, helping employers promote health and wellness, helping mayors make better decisions, and much, much, much more. It's a real living proof of the principle of Joy's law, right? Bill Joy's old saying that no matter who you are, you have to remember that most of the smart people in the world don't work for you. And our corollary to that is if you want to maximize return, social return on taxpayer investment in data, don't just have HHS's own smart people and some other smart people scrub into it. Have everyone and anyone that could use that data to produce good for the public be able to access and use that data to produce magic for the American people.
Yeah, it's empowering the ecosystem, right?
That's right, that's right. The whole point of the Health Data Initiative is not just to liberate data, right? Because data by itself isn't helpful, right? It's to actually catalyze the emergence of this decentralized, beautifully chaotic, self-propelled, open ecosystem of innovation. We have all kinds of innovators taking the data and applying it in all kinds of powerful ways to help improve health.
So give us an example. The blue button was a great one.
There's lots of different data that's being liberated. Everything from community health performance data to healthcare provider quality data to Blue Button, which is an effort led by the Department of Veterans Affairs working with DOD and with Medicare. That's now allowed every veteran, every member of the military, every Medicare beneficiary to go to a secure website, authenticate themselves, and then download a copy of their own data, which they can then upload into personal health records.
Which is HIPAA compliant.
That's exactly right. It's absolutely HIPAA compliant, and more private sector organizations are now actually adopting Blue Button as well. Information about what health insurance products are available across the country has been liberated. FDA recall data in downloadable XML format, the latest and greatest medical knowledge from the National Library of Medicine made available through the Medline Plus Connect API. It's consumable by electronic health records, personal health records. So I can go on and on, but there's just an enormous amount of data that's being made available, that's being made machine readable. I mean, a lot of our data that's been out in the public domain already is not consumable by third-party developers. It's in PDFs or books or websites, and so so actually are making a priority to make it machine readable and accessible via downloadable files or APIs, and then educating the world of innovators that this data exists and is available to them. So they can turn into all kinds of amazing applications and services. And so, and the kinds of things people are building, range from apps and services that help you find the right healthcare provider for you, and then book an appointment with that provider, to search engines that actually leverage a bunch of this open data to deliver much higher quality, precise search results when you're looking for health information. Tools that help doctors and nurses get a better sense of what's going on in their community and in their patient populations, so they can actually target actions appropriately to help their patients be maximally healthy. Tools that help journalists identify key issues like health disparities in their community that they can then write articles about far more easily because they've got the data and massive crunching power that developers have built for them. Tools that help mayors, public health officials, see things like food deserts where you can't get access to healthy food, swaths of America where you can't get access to affordable healthy food, and craft better policy. Just the list goes on and on. And what's phenomenal about what's going on is that this is stuff that's being built by American entrepreneurs, right? Right. All the government had to do was essentially take data and jujitsu it into the public domain, make it machine readable, and market the fact that it was there. And the American entrepreneurs and innovators are doing the rest, which is absolutely amazing.
Amazing. So where should entrepreneurs go to find out all about this data liberation and be able to leverage it?
Well, you can go to healthdata.gov, which is a site where most of the data is available. All the data that's fully open, downloadable, and accessible via APIs. Some of the data sets like Blue Button aren't there because obviously Blue Button isn't available to be downloaded by you and me, right? For Mrs. Jones. Mrs. Jones can go to myhealthyvet.gov or mymedicare.gov and authenticate herself and download her own data.
Sure.
But the stuff that's actually fully open is all available at healthdata.gov. If you want to learn more about Blue Button, you can go to bluebuttondata.org, a site run by Robert Wood Johnson Foundation that allows you to see the dummy formats for Blue Button data so you can learn how to actually upload and parse it into your application or website. And we're also actually hosting our third annual Health Data Palooza. It's actually being hosted by the Health Data Consortium, which is a public partnership led by Robert Wood Johnson Foundation, Institute of Medicine, O'Reilly Media, Health 2.0, Innocentive, Healthways, Gallup, HHS, California Healthcare Foundation, Lucille Packard Children's Foundation, Mayo Clinic, Consumers Union. So this consortium is actually holding this big Health Data Palooza, June 5th and 6th in DC at the Washington Convention Center. And if you go to hdIforum.org, you can register for the forum. And actually, by March 30th, if you're interested, you can actually apply to be a speaker at the forum to present your health data-powered innovation, product or service. It's just a short web form. You just upload some PowerPoint slides. And then you'll then be entered into this American Idol-style bake-off process where panels...
You're one of the judges?
I'm not a judge, actually.
You're not a judge.
I'll be an observer. Okay. And I'll cheer everybody on. But there'll be panels of patients, panels of doctors and nurses, and panels of community leaders who will actually judge over WebEx each of these innovations, and they'll actually narrow it down to the ones that we presented at the Health Data Palooza June 5th and 6th. So you can go to hdIforum.org to apply by March 30th to present, and also actually register to actually be at the event. Also, we're interested in folks volunteering to be judges as well. So you can sign up to do that too.
Awesome, awesome. Well, thank you for all your work you're doing in enabling a healthier America. And,
thank you.
Thank you for speaking to our viewers.
Thanks so much.